Our next speaker is James Mathy from the Housing Division of the Milwaukee County Department of Health and Human Services, where he's the administrator of that division. He has over 20 years of experience working in the housing and community health field with a focus on the development of homeless programs and permanent supportive housing. You'll notice in your agenda that it indicated that Mr. Matthew would be presenting with Robert Itzen. Unfortunately, Mr. Itzen's not able to join us today, but I do wanted to thank him for his involvement in preparing for this briefing, his willingness to share some of his experiences, and his work with the Resident Advisory Council with Housing First Milwaukee. Take it away.
Thank you very much, Sam. Thank you all for being here today. As a housing advocate, it's a special day for me to be able to talk about this topic in front of everybody that cares about health and healthcare, and I think there's some exciting things you'll hear from UHC about some of our new partnerships. So this is a very important topic for those of us in housing dealing with homelessness. So I'm going to touch today on Milwaukee County, our housing division's plan to end chronic homelessness using the housing first approach. And when you see the words functional zero, that's actually a HUD language, but it's very important to this conversation. Pretty much means that when you're ending chronic homelessness, it means that you have enough housing stock to basically instantly house every chronically homeless person on the street and put them in housing. So if you see that term, that's what that means. So I'm going to start by talking about the words housing first. So one of the big takeaways from today as it relates to health and homelessness in general is the number one solution to homelessness is permanent housing. So when this is debated throughout the state of Wisconsin, we talk about policy changes, we talk about investments. If your number one investment is not permanent housing, you are not going to decrease homelessness in Wisconsin. So that's one of the most important things I want folks to take away from this today. So again, it is a housing problem. We believe in our division, Milwaukee County, housing is a right to which people are entitled to. And again, providing permanent and independent housing without prerequisites to treatment. So again, when we're talking housing first, that means we're taking individuals directly off the streets. I think the average age of our first 100 participants for being on the street, they were homeless for 8 years, literally sleeping on the streets. So the most important thing for them is getting them in permanent housing, and then we wrap services around them after they're in housing. There's no prerequisite to treatment. Folks don't need a psychiatrist. A lot of the individuals sleeping on the street have very serious substance abuse disorders. We're not asking them to go to treatment and go to detox and go through all these steps before they get the dignity of housing. We flip that now. It's been very, very successful. So again, placing an individual as quickly as possible into permanent housing is our goal. Again, we offer 100% of the individuals in our program wraparound voluntary services after they're in housing. The goal is to remove any major obstacles to obtaining and maintaining housing. That's housing searches, that's income, that is getting folks on SSI, that's getting people employed if they are ready to do that. Whatever it takes, whatever obstacles people have to get into housing, it's those wraparound services and our community intervention work in our division that does that at the offset. And again, the opportunity to secure housing rather than having to earn it. And that's when folks are learning about housing first and looking at the way that we dealt with homelessness, say 10 years ago, this is hard for folks sometimes to wrap their mind around. Why in the world would we give somebody free housing? They should have to meet these prerequisites. They should have to be sober. And why do we do that? And you will see in my slides coming up why we do that. So we strongly believe in our mission and the dignity of housing, but if you look at the cost savings, the Medicaid savings, the decrease in jail days and our criminal justice costs, it is night and day when we're looking at the cost of providing housing versus the cost of emergency services in our community. So we can certainly look at it that way as well. So again, key principles, as I spoke about, immediate access to housing. And again, we take individuals right off the streets that have never been in their own apartment before, and we give them keys and we move them in, and we wrap very complete services around them after the fact. Autonomy, personal choice. A majority of our housing units in Milwaukee are scattered site vouchers. Our individuals get a housing voucher, they can go anywhere they want to. It's not just the worst areas of Milwaukee or where the rents are the cheapest. If folks want to move in the suburbs, if it's a homeless family and they're concerned about their school district, they're able to move to suburbs with our help finding units. Social and community integration. We try to build communities around some of our project-based type living. We bring supports in there, try to make people feel like they're a part of a community and not just being isolative. And then community development. This is another important aspect when we're looking at new construction for homeless projects, those different types of things. One of our earliest adopters in Milwaukee for our homeless initiative was the downtown business district. So they're a huge supporter of our Housing First initiative. We've seen a huge drop in homelessness in downtown Milwaukee. The reason why is because of Housing First and our outreach efforts down there. And the business community is our #1 supporter. They're now giving us donations. They're calling my staff instead of the police when they have nuisance behaviors downtown. It has completely changed downtown Milwaukee because of this initiative. So major themes of approach. So how do we succeed? How can other communities succeed working on ending homelessness, but specifically chronic homelessness? Housing subsidies for permanent housing, and when you work on that, do it more. So this is the #1 thing that our community needs to do a better job of. Dr. Curtis mentioned housing choice vouchers and the scarcity of subsidies. It is a very scarce resource. I would challenge our community and our country to think about that a little differently, local or federal level. And again, we've got some creative ways that we can do that as a community. Again, even at the state level, there's been some wonderful conversations about homelessness at the state level, and that's really, really encouraging. Again, if we don't talk about permanent housing in those debates, we're not going to see our homelessness numbers in the state drop at all. So that's the #1 tenet to this. All of our individuals have some form of a rental subsidy, either through our division or through the local Milwaukee Continuum of Care. Case management services. So we have various case management services. Every single person in our Housing First initiative does receive case management. So in a perfect world, they're Medicaid eligible, and they go to our Milwaukee County Behavioral Health Division, and they receive community support program support, targeted case management, Medicaid waiver programs, and that's great. So if a person wants to enter recovery services, they want to see a psychiatrist, they want to take medications, they want to do those things, they go into our traditional case management system, and that's great. What we certainly have found, and one of the reasons we started this, is the majority of the folks on the street did not want to do that. They would choose to live on the street before they accessed these very clinical services that they did not want. And the old way of doing that in a lot of communities is, well, until you're ready for that, you can stay in the shelters, you can stay on the street, call us when you're ready. And that just does not work. So we actually have a different type of case management now within the housing division. We actually provide case management within our division, not just housing. It's called Housing First Case Management. So we don't worry about what's billable for the Medicaid. We don't worry about what your treatment plan looks like. If you get into housing, our goal is that you remain in housing, you remain out of the hospital, you remain out of jail, and you tell us what you want your plan to look like. If it's bus tickets or employment or a ride to the grocery store or reconnecting with your grandparents, that makes no difference to us. And we're really, really flexible about that. So what we found, we've served well over 700 individuals, and 100% of them have accepted voluntary case management. So for a lot of clinicians that I work with, the goal is to get folks in treatment. Eventually they'll get there, but it has to be on their terms. That's another big proponent of Housing First. Outreach and staffing, we started our own homeless outreach out of our division, which is a little different for government to do that. But to really ensure the outcomes that we're looking for, ensuring our success, we wanted to help take the lead for homeless outreach. So all of our faith-based providers, all of our nonprofit outreach providers all meet with us in our office on a monthly basis with the Milwaukee Police Department. We organize every single area of Milwaukee County, working with the police where homeless encampments might be, making sure faith-based groups aren't working with the same client twice. We share all of our information to make sure all of our area is covered, and that's really helped dramatically reduce homelessness in Milwaukee. Additional supportive housing developments, again, we do some project-basing developments as well that I'll get to a little later. Coordination of resources, so we've gotten to the point now where our whole entire system, including our permanent housing resources, all go through what's called coordinated entry through our 211 system, which a lot of communities have. Ours is kind of on steroids at the moment, so every single referral, even ours coming off the street, all go through coordinated entry. We work with our coordinated entry provider once a week and go through every single homeless individual on a list in order. We know exactly where they are. We know where they're connected, whether you're chronically homeless or not, and all that's done through a very highly coordinated process. Wide range of community partners. Again, part of this was getting the entire community to think differently around this housing first philosophy. And we have a lot of different partners that you might not think. One of our earliest adopters that we work with all the time is our district attorney's office. So we meet with the downtown business district again weekly, and the district attorney's office is there. They've even gone out on homeless outreach with us, waiving people's warrants on the street so they didn't end up in the court system. Very, very expensive to take somebody with no income throughout the entire court system. They can't pay fines, they have no money, and they cycle in and out of jail on very, very small municipal violations in downtown Milwaukee. Our police then see the same people on the same streets over and over again, and that never changes. So we have the district attorney's office, the police department, downtown business district, Marquette University, all these different areas that had really severe homeless issues in Milwaukee. Aren't seeing those folks around as much anymore. So they were early adopters. Now they're financially participating and doing a lot more work around that. So this is an example. Again, most of our housing is scattered site. That doesn't work for everybody. And if we're serious in communities about ending chronic homelessness, you have to have a lot of different models and some pretty intense ones. And this is our example. There's very few like this in the country, actually. So this is Thurgood Marshall Apartments. It's a 24-unit apartment building. This is what I don't like the term, but folks would know it as wet housing. So these are individuals that were chronically homeless, living on the streets with very, very serious alcohol addictions, in and out of detox. There was one individual that had, I think, 150 detox days in a year, and the expense to Milwaukee County with that was astronomical. So these are individuals, again, they kept ending up in jail over and over again. The police, all of them, knew them by name, and they weren't going to be successful in a scattered site housing development. So we accomplished this. So this was done with low-income housing tax credits, as the doctor mentioned, through WIDA, some subsidies through Milwaukee County. We subsidize the rent with 24 vouchers and provide very intensive services inside. And we deal with all these substance abuse behaviors in their housing unit. We don't evict individuals. We deal with all those behaviors in the housing unit. So if people are drinking an awful lot, we just accept that behavior. We're not going to ask people to be sober. It does not work for this population. They will be back on the street. So we fund all those services actually at a local property tax levy, believe it or not. Why do we do that? Because it's saving a ton of money. Our individuals have no need to go to detox anymore. We'll manage that right in their housing unit. Emergency room visits dramatically lower than they used to be. So especially policymakers, when they hear some of these things, we're giving away money to people that don't deserve it. And just mission-wise, we don't agree with that, but even more so the amount of money that we're saving, and I'll get to some of our slides with the cost savings, specifically about Medicaid for this conversation. It's really a dollars and cents issue also. So I mentioned the Homeless Outreach Collaborative. It's just important to look at all the different partners that are doing this. Again, I mentioned the police department, district attorney's office, medical college, healthcare providers. We have everybody now looking at this in the same way, and that was not the situation in Milwaukee. I know it's not the situation throughout communities in Wisconsin as well. But when you get everybody on the same page with a general philosophy, you will see a decrease in homelessness in our state. So briefly, where we began, so we presented this plan to County Executive Chris Abley to try to get this off the ground in 2015. Our goal was to end chronic homelessness in 3 years, which was really, really fast for Milwaukee. So just some brief numbers. We had about 200 chronically homeless individuals on our point in time count. For those of you that don't know what that is, HUD kind of has you count homeless individuals once or twice a year. The individuals that are sleeping on the street and in your homeless shelters, we've gotten very, very scientific in Milwaukee, where we're pretty confident of our numbers. 3-4 years ago, not so much. So we started with a number of 200 chronically homeless individuals. And again, these are the most difficult to house. We want folks off the street. We want to reduce Medicaid. We want to reduce jail days. So our first goal was to place 100 individuals within 12 months and 300 over 3 years. We are way beyond all those numbers, number one, because it's necessary, but number two, Housing First has been extraordinarily successful. So here is one of our big slides. So these are the total number of homeless individuals in Milwaukee County. So, and Sandra and I were talking before about shelter versus permanent housing and how this is done. We have very well-meaning people in Milwaukee, always have. We have throughout our state. We have people volunteering at homeless shelters. We have people giving to different charitable organizations. And that's been great. So you look at 2007 through 2015, people continued to donate. They continued to do these different things. Nothing was changing the homeless numbers in Milwaukee County. We started Housing First with permanent housing right where that arrow is, and had one of the largest drops in homelessness in the country, quickly, from 1,500 down to 900. I put this 2018 number up. It's not necessarily public yet, but I guess it is today because I put it up there for you guys. But it is not into HUD yet. We're looking at right around 832 for our new point in time number. Will it go much lower than that? Most likely not. A majority of those individuals are living in homeless shelters, not on the street. But we've gotten that number very, very low compared to where we started, and it is directly correlated to permanent housing. And again, just our division alone, not counting our continuum of care, served about 700, 800 homeless individuals. And you can almost see it number by number with the provision of permanent housing. So here's another, so it got cut off a little bit. Sorry there, Sam, from the conversion. So this is another important thing that we focused on was municipal court violations. So the last number for some reason got cut off on all these. So if you look at our chronically homeless individuals, we actually have a program evaluator on my team whose sole job is to do pre and post housing comparisons based on an individual's criminal justice history, behavioral health division visits, jail days, all those different things, and do a pre and post housing comparison to make sure we're telling our politicians and our funders that we are absolutely saving a lot of money. This is a big slide with that. So since the last number got cut off, you can tell with Housing First began September 2015, that 21 is actually 219. So that's 219 municipal violations for 100 people. This slide is only for the first 100 people we served. The number in 2016 dropped to 39. So we saw over an 80% reduction in municipal violations that were taken away. Why is that important? Our downtown police department should not be spending their time writing our clients municipal violations when they could be doing other things. So the police department is extraordinarily glad that we started this initiative. They are not seeing these individuals downtown anymore. If they do, now the police officers have somebody to call. There's no reason to write very, very low-income individuals tickets. Work with our division, call my staff, we'll be there in 45 minutes. We're close to downtown anyway. So that has been a big thing for us. Here's the big slide for why we're here today and how it directly relates to health. So this is a slide that has to do with savings, Medicaid savings, and savings to our behavioral health division. So again, these numbers are from roughly 100 people. And again, we've served over 700. So let's think about that when we go over these numbers. So we saw in 4 programs alone through the behavioral health division, about a $715,000 savings in 1 year for 100 people. So this is our crisis mobile team, this is detox, psychiatric crisis service, and inpatient services. So we get, as an example, $1 million a year from the behavioral health division in tax levy for Housing First. Why on earth would they do that? Here's why. So this is way more than a dollar for dollar savings for the behavioral health division. What's not on this slide is any cost to the criminal justice system. So we have other data that shows if an individual gets a ticket downtown, it's the police officer's time, the call from the business to the dispatcher saying there's a homeless individual downtown. They get booked, there's that time, there's a district attorney's time, there's the public defender's time, there's the bailiff's time. It's an awful lot of money. So this is just from these 4 services, and it's also not including emergency room visits and healthcare costs and all these other Medicaid costs for just 100 people. So the cost savings to our Housing First initiative, if you did dollar for dollar, is probably a 10-to-1 savings, and people are off the streets and they remain in housing. So these are some of the justice system numbers. And again, when you look at all these different numbers, this came out of a MacArthur grant that we did to get some local numbers. So when you're giving a homeless individual a ticket, every single one of these per case and per call numbers is all combined for one ticket and one arrest. It is extraordinarily costly. So here's some current calculations. The exciting thing, I've got the point in time numbers there, 70% reduction in chronic homelessness from where we started. We are on pace this year to be the largest county in the nation to end chronic homelessness, in Milwaukee of all places. So obviously we're very, very excited about that. Thank you. And the reason I point that out is not for the applause, but to get other areas in Wisconsin, policymakers thinking about this. This is the playbook for ending chronic homelessness, focusing on permanent housing and using Housing First, looking at different ways to invest in housing to save far more money on the back end. So the cost for a Housing First unit, that's with our subsidy and case management, $30 a day. So that supports somebody with rental assistance and the wraparound case management that our division does. So it's about $6,300 a year is what that's going to cost for a rent assistance voucher with a 97% housing retention rate. Again, individuals highly addicted, very, very acute mental health issues living on the street are 97% successful remaining in housing on their terms. So again, huge cost savings there. And all of them accept voluntary case management. Again, and there's a lot of clinicians on our team that get a little nervous talking about Housing First because they want treatment and they want to know what the individual's diagnosis is and all these different things. What they come to realize is folks will get there. When we talk about social determinants of health and all the things we want our clients to do, we want our clients to get a job, we want them to do all kinds of things. But what I say in public events is, if any of us were sleeping on the streets, are we going to search for a job? Are we going to try to be clean? Are we going to find out where our doctor is? No, we want a roof over our heads, and we might want bus tickets to get to our appointments. Until we focus on that, the rest of it is not going to matter, and we all will not see a decrease in homelessness in our state. So unfortunately, Robert is not able to be here today. This is something we're also very, very proud of. It's the Resident Advisory Council. So again, we take very seriously peer support in Milwaukee County, and a lot of our initiatives are ran by our Housing First consumers. So this is our Resident Advisory Council. Robert is the chair of that. So we have individuals, again, these are individuals that were living on the street. Robert is a phenomenal individual. He actually has a master's degree in journalism. And brilliant. And these individuals direct us on policy. They will go around and meet with our clients throughout the community. They do all of our charitable work, our client picnics, and they also interview all of our clients for what they want our program to look like. And we absolutely will change our programming based on what our residents tell us. Again, it's all consumer empowerment and what that looks like. So Robert has a long history of editing, so he did our quarterly newsletter. I really wish he would have been here today. This was a challenge for him to speak about these issues this publicly. So this came from our homeless individuals' minds to do this. So this is their quarterly newsletter. It reads like a magazine, comes out every quarter. Maybe I can get, Sam, maybe I can get you the electronic version of this. We're going to do this every quarter, and they interview policyholders. Robert interviewed the county executive for the second issue. Goes around to different community members talking about Housing First, our initiative. And really, the biggest thing is providing community education to reframe the conversation about homelessness, what it looks like, and what our policy should be. So it's a really important part to what we do. So that's what I have. I'm happy to take questions.